In Riverside County, the rapid population growth raises concerns towards healthcare capacity for the area. Local governments must push the agenda of healthcare expansion at a rate we have not seen before.
So there was a time when there wasn't even a signal in this area here, and people had to go see doctors that weren't even from the Temecula, Murrieta, Wildomar, Lake Elsinore area, had to go out of town, and when they needed an important medical procedure, had to actually export themselves to other communities.
Riverside County currently has 18 active hospitals for its citizens. This means that if divided evenly, each hospital is responsible for roughly 128,000 patients at any given moment. It's clear why this situation can be daunting.
The opening of a new Rady Children's Medical Plaza in Murrieta, along with the addition of a bariatric department at Inland Valley Hospital, are just a few examples of improvements.
What we've seen is, with our wonderful growth that we've had here, 250,000 people living in the Temecula Valley alone, we've seen 4 hospitals, we've seen a lot of physicians coming into the area that are specialties. I'm very proud, and it has a tremendous economic benefit to this area as well, because these surgeries are not cheap, they're expensive, and so we're keeping all those millions of dollars, if you will, right here back in the community to be reinvested. So it's a win-win. It's a win for the patients, and it's a win for the region.
There are many other changes in the works. I spoke with Mike Fensel, Group Vice President of Universal Health Services, to learn more about the future of healthcare in our area.
Well, Universal Health Services is the largest provider of acute care services in Riverside County, and we are in the process of completing a master plan for the 2 hospitals that are part of Southwest Healthcare System. In Temecula, we recently completed a $40 million expansion project, and our next plan is to actually expand the emergency department as well as the second patient towers. We have an aging population, so it's going to be critically important for us to work with local schools to get the qualified nurses and other healthcare professionals to support that utilization. And finally, just the management of the population, the health, and how we go about delivering that care. I think you'll see continued transformation from the inpatient side to the outpatient setting, and we have to be prepared to handle that, because that's going to be a more cost-effective approach in delivering care. The responsibility for delivering the highest quality care that promotes patient safety and clinical outcome improvements is something that we're all committed to doing, not just our hospitals, but the entire hospital industry. And I look forward to watching us improve in those areas as well.
Mike, thank you for coming.
Thank you.
Great efforts by hardworking teams of people here in Riverside County is what made these improvements possible. This work ethic will continue to push us further into the future of medicine while making our home a better place to live.